Year, more and more people are taking part in what's called Dry January. It's a trend where people hit pause on drinking for the month and shift their focus and priorities to health. Joining me live to break down the effects this can have on your body is Dr. Benedict Ifedi, a family and sports medicine physician with Memorial Hermann. Doctor, good morning. Thank you so much for joining us. Happy New Year.
Good morning. Yeah, thanks for having me.
Talk to us about the benefits to giving up alcohol for, say, a month.
Yeah, no, there's numerous benefits. Big ones that to think about is that you have increased energy, clearer mind, sharper, better concentration, improved sleep, kind of truly restful sleep. And then also you can potentially have weight loss as well, too.
Shed light, all great things, right? Shed light on what one drink, a single drink, does to our body's ability to achieve that needed rest and maintain that healthy weight balance.
No, of course, yeah. When you think about even one drink, it can mess up your normal circadian rhythm. So your wake-sleep cycle is disrupted, meaning it's more difficult to fall asleep and stay asleep. Sometimes people will have a drink before bedtime and it'll help you fall asleep, but that sleep is not going to be restful. You're going to be tired the next day, decreased concentration, can lead to mistakes at work or school. And then from a weight perspective, when you think about drinks such as beer or wine, they have a lot of unforgiving calories that can really prohibit you from losing weight, especially if your calories in is not more than your calories out.
Yeah, not to mention, too, the sugar, right, in these drinks. This obviously impacts our mood. You talk about our personal life. You mentioned our work life. But at the core of it is our mental well-being. It's how we say good morning, right? Talk to us about how this impacts our mood.
Of course, yes. It does work on some of the neurotransmitters in your brain. Initially, it can increase the feel-good hormone of dopamine, make you feel happy, but it can also make you feel sad and depressed. It can cause you to have mood swings. It can increase anxiety. It can decrease your concentration and also decrease your inhibitions, which could lead to bad decision making, especially when you think about folks drinking and driving, which we know can be deadly.
Yeah. Yeah. You mentioned some of the health conditions, right? The inability to get proper sleep, functioning during the day. It also can be impactful to our organs, though, right? Our liver.
Yeah, for sure. So the liver is one of the primary places where alcohol is broken down. And if you drink too much alcohol, it can overwhelm the liver and prevent it from doing the things that it normally does for us. So think about digestion, your metabolism will be messed up. It also is a place of storage for a lot of your crucial vitamins and iron, and it can also decrease your immune system, which the liver does as well.
There's 31 days in January, also known as what we're calling Dry January here. What if someone watching right now says, you know what, I really want to do this, but I have, say, a birthday, an anniversary, and I'm really looking forward to toasting to that. Obviously, there are mocktails, right? Folks can participate in, but breaking that dry month, maybe call it like a damp month, could that still be beneficial?
I think it still could be beneficial. I don't think you have to be rigid. I think just the idea, honestly, of decreasing your alcohol intake, you're still going to have those health benefits. So don't feel like you have to be too rigid. The other thing I want to, caution folks as well, if you're on the fence as far as if you feel like you may have a problem with alcohol, like alcohol use disorder, make sure you talk with your healthcare provider, your physician before doing it, because you can risk going into withdrawals, which that can potentially be deadly as well.
And that's a conversation to definitely have with your physician about how to navigate that moving forward. Okay, Dr. Ifedi, thank you so much for your time. Always a pleasure chatting with you. Happy New Year.
Thank you. Happy New Year.